My name is Dr. Marilyn, and in this short video, I'll be sharing information on Rift Valley fever disease. This is a disease that's caused by a virus, flavivirus, in the family of Bunyaviridae. It causes severe disease in humans and animals. Now let's move to the PowerPoint presentation. Introduction. Rift Valley fever is an acute viral disease that can cause severe disease in domesticated animals, such as buffaloes, camels, cattle, goats, and sheep, and also in humans. The disease is characterized by fever, severe illness, abortion, and a high mortality and morbidity rate. Background. Rift Valley fever was first detected in Kenya's Rift Valley in the early 1910s. It is found in eastern and southern Africa, where cattle are raised. But however, the virus exists in most of sub-Saharan Africa, West Africa, and Madagascar. The outbreaks. The first notable episode occurred in Kenya in 1950 to 1951, resulting in the death of 100,000 sheep. In 1997, another epidemic occurred in Egypt, where many animals died as well as 600 humans. In 1987, during the construction of the Senegal River project, an outbreak occurred affecting many animals and humans. In September the year 2000, the first cases of Rift Valley fever outside Africa occurred in Saudi Arabia and Yemen. In December 2006, the outbreak occurred after a recent heavy rainfall and affected both humans and animals in Kenya, Tanzania, and Somalia. In Kenya, the virus was isolated from 10 patients. In February the year 2010, Rift Valley fever was diagnosed in South Africa and affected both animals and humans, resulting in the death of 15 humans out of 172 cases, 139 who indicated that they had been in close contact with animals. The transmission of this disease. Humans are infected from bites of several species of infected mosquitoes. They are rarely from other biting flies, but most commonly, humans are infected after exposure to blood, body fluids, or tissues of Rift Valley fever-infected animals. Aerosol transmission has occurred in the laboratory environment. Environmental factors, particularly rainfall, is an important risk factor for outbreaks. Episodic events and outbreaks in humans have been observed during years in which unusually heavy rainfall and localized flooding has occurred. The maintenance of the virus. Vertical transmission occurs where the female mosquitoes transmit the virus to offspring via the egg, and in the egg, the virus remains infectious for several years during dry conditions. Excessive rainfall makes more mosquito eggs to hatch, and as the population of mosquitoes increases, so does the potential for the virus to spread to the animals, including humans, on which they feed on. In episodic events, there is increased handling of infected animals, which then increases risk of exposure to humans. The signs and symptoms associated with this disease. In humans, the incubation period is 2 to 6 days following infection and can cause different disease syndromes. Most commonly, people have no symptoms or have a mild illness associated with fever and liver abnormalities. Patients who become ill experience fever, general weakness, myalgia, weight loss, back pain, and dizziness at the onset of the illness and recover within 2 to 7 days. 1% of the affected people sadly die. 8 to 10% develops severe symptoms, including ocular disease, various blood and decreased vision, and about 50% of patients get permanent vision loss. 1% of affected people suffer from encephalitis, leading to headaches or seizures. Sometimes neurological deficits may persist. 1% develop hemorrhagic fever, that is jaundice and other signs of liver impairment. They vomit blood, they have traces of blood in stool, they have bleeding gums, the skin bleeds, nose bleeds, and the sites of injections also bleed, followed by death in 3 to 6 days. The clinical signs in animals: we have abortion in 80 to 100% of the affected animals, the sudden death, nasal discharges, excessive salivation, loss of appetite, weakness, and diarrhea. We can arrive at a tentative diagnosis by the use of the clinical signs in endemic areas, insect activity, concurrent disease in animals and humans, and contributing environmental factors. The diagnosis can be confirmed by these tests: virus isolation in cell culture, antigen detection using ELISA, molecular techniques, or PCR. We can also do enzyme-linked immunoassay to detect the presence of IgM or immunoglobulin M and immunoglobulin G, antibodies specific for Rift Valley fever virus. The high-risk groups are spending time in rural areas and sleeping outdoor in regions where outbreaks occur is a risk factor for exposure to mosquitoes and other insect vectors. The people who had animals, abattoir workers, veterinarians, and international travelers visiting Rift Valley fever endemic locations during periods of sporadic or endemic cases are other risk groups. Prevention strategies in man: we try to avoid contact with blood and other body fluids as well as tissues of infected animals, protecting oneself from mosquitoes and other blood-sucking insects by use of mosquito repellent and bed nets, wearing of protective clothing also, and case surveillance systems and environmental monitoring may aid in prediction and control. Prevention strategies in animals: we can use quarantine, vaccination, also surveillance for the Rift Valley fever disease, and formulating measures to reduce the number of infection can help in prevention strategies. We can also close the auction yards to stop the animals from moving. The management: we manage human cases in the following manner. Most human cases are mild and self-limiting, so we don't do anything. But in the rare but serious cases, the management given is that of supportive care. I hope this short video has given us more insight in the Rift Valley fever disease. Thank you for listening.